Okay, good afternoon, everyone. I've been really enjoying the presentations today. It's been, I've picked up so many thoughts and ideas and linking things together about a whole range of things that obviously we think about in public health planning at Casey. And look, I'm not sure after all these terrific presentations that I'm going to offer you any amazing new insights. Probably what I'll do more than anything is probably affirm some of the things that are similar themes in a sense, but there might be a few new things that you might pick up out of the things I'm going to say. As Stephanie introduced, Casey is a rapidly growing area, and I think that has implications for the kinds of issues, concerns. Some of them are very similar, not the same as many other areas of Melbourne, but certainly growth areas have their unique challenges, and I guess just the sheer pace of growth means that there's a lot of reactive work done all the time, a lot of pressure in local government to just keep up with trying to meet demand. So sometimes not necessarily the time to be incredibly reflective and developmental in lots of areas. So that does affect the work we do. I'm part of a small health promotion team at the City of Casey, and my role is to support the development, implementation and evaluation of our public health plan. So I just want to tell you a little bit today about how we're using indicators to guide that public health planning, and also to try and start informing some of our efforts around addressing health inequities in our municipality. Next one. So I think it was certainly has been spoken about earlier, so I don't need to really say much about this, but certainly local government's role is in as a legislative responsibility is to protect, improve and promote public health and wellbeing, and part of that requirement under the legislation is really for us to get a good handle on what actually are the issues and concerns in population health in our municipality, and for particular sections of that population who may be experiencing sort of different or more intense kind of problems. I suppose the thing to say is, and probably with most public health plans in Victoria, we've had a significant shift in our public health plan. I've been in our council for about 6.5 years now, so I'm actually into the second cycle of being involved in a public health plan. Our 2002-2008, we had a 6-year plan at that stage, when I came into council, was very much a risk factor based plan, and sort of that was pretty well I'd say sort of state of the art in Victoria, that plans were framed around these sort of areas. For our 2009-2013 plan, we started to shift toward a social determinants plan, and that was really in line, I guess, with changing state government expectations about local government's role in the delivery of health and wellbeing outcomes, and that we were to sort of be taking on a more sophisticated approach, if you want to put it that way, about how we addressed public health and wellbeing. And albeit I think the Victorian plan, health and wellbeing plan, is still very much a risk factor based plan, which I think, and at a federal level we've had risk factors too, so it does present local government with some issues about how we frame the kind of work we do in relation to public health and wellbeing outcomes. And I suppose risk factor approach in some ways is far less relevant to the way we think about our work in local government, as much as it contributes to outcomes in risk factor areas. So as been mentioned before as well, local government obviously has a significant role to lead work in the social determinants of health, really through the work we do in areas urban planning, community safety, community connectedness, housing, a whole range of areas to varying degrees in local government in Victoria. And additionally, we have over time, I guess, an increased emphasis on what these health and wellbeing outcomes look like for particular sections of our population, particularly spatially based considerations, so geographical areas of social disadvantage. So with our 2009-2013 plan, we chose 7 social determinant priorities, and we really started this process of trying to align this discussion about social determinants and health and wellbeing outcomes to the core business of council, to start having those discussions with departments across council about making that connection. And I know from colleagues in other local governments in Victoria, we were all starting to have those discussions. We were starting to say, okay, local government does all this work across social determinant areas, but how do we understand that in terms of public health and wellbeing outcomes? That it was sort of like joining the dots in some way. So really through the life of that plan, we did a lot of internal work, and we were talking about a simple concept in a way. We kept coming back to saying it's not just about what we do, but it's about how we do it. Because we could say, well, look, we do a whole lot of work in local government in social determinants, but we're really not clear on our effectiveness and our evidence base about how we do that work. So we wanted to start thinking about the how, which is the effectiveness, which is about the impacts that lead to outcomes. So making that kind of logic there. Our newest plan, which has just gone through council last Thursday night, hooray, now has 10. And the interesting thing was our steering committee were very adamant that with our previous plan that was a lot of areas, 7, and that was a bit outrageous. We've now got 10 this time. So I don't know what that says, or whether there's just a more sophisticated understanding of all the kind of factors that impact on health and wellbeing, that we've started to say, yeah, but what about this and what about that? So we actually ended up with 10. And I suppose this time we're really trying to push things a little bit further to look at best practice planning and how we can align these priorities, really our social determinant priorities, with this idea of components of a livable, healthy, sustainable city. So moving into that sort of thinking. And for each of these 10 areas, we have a set of partnership action areas, and we're embracing indicators as part of this approach. So this plan will have a greater emphasis on integrated planning and, this best practice idea around working in these areas, and obviously working within council but with partners as well. For our previous plan, when we developed that plan in 2010, which when that plan came into action, we introduced for the first time an outcome reporting framework. We felt we needed to sort of embed a set of indicators. So we had we felt that was really important, because we just needed to get this clearer picture of the social determinants for our municipality. And we knew we had a whole range of data that was collected across areas of council. It was not as if no one was thinking about this, or no one knew anything, that the environment area or other areas of council weren't aware of the sorts of things that were measures of either the problem or success. But it really wasn't aggregated, and it wasn't framed around health and wellbeing either. So we felt we needed to start the process of pulling this together. So we had a consultant sort of develop an at-a-glance understanding of Casey's progress, and it was really formed part of an evaluation framework that we'd set up, which was really looking at outcome, impact and process, standard evaluation thinking. But we felt we really needed to get this outcome in place to know where we were heading, so that we could start looking, and then we could start trying to tackle, if we put it that way, how we were going to start talking about effectiveness and impact in our organisation. How did we know we're actually making change toward affecting these outcome indicators? What was the role of partners in that? How did we... And I know that's come up today too, about having those discussions. They certainly came up in our council about, well, but we're not responsible for, we're not local government's not responsible for making all these changes in these outcome areas. And, you know, just even having to have those discussions about, well, that's then, you know, the relationship with partners and, you know, who's doing the work and how we're all working together to make these changes in the future. Our set of outcome indicators were selected for their ability to develop a clear understanding of our progress across the 7 determinants at that time, and they were developed with a number of criteria in mind. How well does the indicator measure progress toward the desired outcome? How accessible is the source of data? How onerous is the data gathering and reporting? How complex is the calculation from the raw data? And these things are important because, you know, I'm certainly working in health planning. I mean, I'm not necessarily a statistics expert, etc. So you have to think about actually resourcing these and how they're going to be updated and etc. And what costs there would be in reporting on these indicators. When we developed our outcome reporting framework, we introduced it to managers across our council, and we really assigned them the responsibility to actually look at these indicators and really affirm that they were a good representation of their work. We'd already worked with them on it, but we had to go back again and say, are these really the sorts of things you want to measure? I mean, it has to be relevant. It's all very well for us to come up with a huge list of indicators and them have no relevance to our whole organisation. So we went through that process, and really was the idea that departments would also take responsibility themselves to do some of the updating of these indicators. It wouldn't just sit in one part of council. We're still working on that. That's another challenge there as well. But I think once we start to get them clearer and align them further with other plans and strategies, I think we'll make further progress with that. So I just wanted to give you a little bit of an example from our outcome indicating framework. The top table there, you'll just see, you know, we have our indicator which is under our priority of community safety, and I think this has been used before. This is about feeling safe in the community, so perceptions of safety. And under the Casey column there, we had the date. We just had the date of the data. We had the current score, or how we were going on that indicator. We had the previous, or penultimate as the language is used, which I didn't even know what that word meant, and I had to go and look at the dictionary, but it was in our data framework. And then a trend on that. So we colour-coded that through using a traffic light system to use to see how we're going. And then our performance, we had 2 columns there. One was a benchmark. So where possible, we tried to benchmark that against other growth municipalities in Victoria, but the data's not obviously always available for that. So where we required, we either did it for our region, which is Southern region, or we did it for the outer metropolitan average, so depending on the data source. But where possible, we were trying to benchmark against growth municipalities. And then again, a signal or trend in relation to that as well. So that's how that was set up. And then the bottom table just gives you a bit of an idea. We had an associated data dictionary that was developed for each of those indicators as well, so that we could, you know, easily go back and have a look at where they came from as well. And really, I guess the traffic light system, it's a pretty simple idea. I know it's used everywhere. It's not highly innovative, but the idea that we felt that work in our organisation, we needed some way that would provide an easy signal when we were talking to, having strategic discussions in our organisation, talking to, you know, managers, departments across council about how we were going on these things, so that we could give a really easy way to look at this rather than looking at percentages or tables and things, that we could just say, look, this is how we're trending, and to give that signal so that we could have those discussions across council about responsibilities in those areas and what strategically we were going to do to respond to these things, sort of work we needed to do, what perhaps new partnerships we needed to form, etc. And here's just the overall indicator set that we used at the time for a safe community. So we were using crime and injury prevention. I just won't go through those, but you know, there's no surprises there. We used a couple for environmental health, that we wanted to look at some public health, some environmental health indicators, and also some alcohol harm, which in our framework we have in the safety area. So that's just to give you a quick idea, and that's probably not dissimilar to a number of ones used by other councils and other organisations. We will need to look at some new indicators for our new plan, so that's going to be a challenge. Some of them we know will be available, but others I think we're going to have to start perhaps having discussions with academics, etc. I'm sure there's going to be discussions at regional levels, etc., with local government to be, you know, potentially looking at new sorts of indicators we might need to reflect the work that we want to do or need to do. And I suppose they're discussions we need to have with CIV and others as we progress that further. But also about, health inequalities and how we work with health inequity, because, you know, a lot of indicator measures are population-wide, and they don't really give us that nuance about what that looks like for particular sections of the community, or how we how we understand that. So, you know, and I guess for local government and in our local government, that's a resourcing issue as well, about getting that sort of data. So once again, I think with this developing work around health inequity and the work that Vic Health's doing as well, I think that's going to be fantastic, because we're going to start being able to use some of this other work to help inform some of that. So there have been some challenges introducing, I've probably alluded to some of them already, introducing social determinant outcome indicators into our local government setting. And I just want to use this sort of cycle of policy, practice and research, or whatever point you start at. But I suppose in an ideal situation, there'd be strong alignment between the knowledge of how our municipality is faring, how we're going on a set of agreed and established social determinant indicators with an equity focus, and how this would actually translate into informing our local policy decisions. And that would in turn, direct the sort of evidence-based informed activities that are implemented and the range of stakeholders we engage with, so that would be a nice virtuous cycle, or whatever you would call it. And that those activities would then be evaluated for their impact on the social determinant trends at a local level. And then our policy and resources allocation decisions would be reviewed and redirected accordingly. That would be a perfect situation, how we would love it all to be in the future. But in reality, we find that local government traditionally has a lot of policy areas that are not framed around health and wellbeing, and have little focus on equity. We found, I guess, where our local government had a strong policy position, so that one of those examples is with community safety, and there had been work done to sort of look at safety and its impact on health and wellbeing, that it was much easier to get that agreement on what constituted indicators. There was an understanding, and it was already there within the policy. But there was other areas where there was either not a clear established policy position in local government, or the policy was under review, or there was little policy connection really to human health and wellbeing, and environment area is probably one of those. There was sort of like, we sort of get, but we don't really have our policy's not really clear about that, because I mean, really the evidence around that is just growing and developing, so it's probably quite reasonable that's not actually reflected in those sorts of areas. And I guess what I'm talking about here is just the need for alignment between, you know, our plans and strategies of council. So, you know, that I suppose it's important for us to build that pathway from the implementation of policy into our positive changes in our community organisational behaviours and perceptions, and then monitor how these translate into community and population health outcomes. So I think that cycle, but, you know, there's some weak points in that cycle, and I think that's, you know, for us, that's a way for us to understand our challenges. And even it might seem simple to try and fix some of that, we can't see that the way to fix it is just to create a huge list of indicators and just sort of try and bang it into shape. I think we just have to keep working to build capacity in our organisation and create alignment between our strategies and plans in council, so that we are starting to use the same indicator language and start to embed indicators into all the work we do. So I think, you know, we're trying to head in that direction. So we think that our outcome reporting framework will help support the work of our new health plan, ongoing monitoring of trends, which I've said using that traffic light system. We're hoping that we can really activate that. We established it with the previous plan. This time we're really trying to, you know, get some real buy-in to it and start to use it strategically to make decisions. To inform our collaborative partnerships, as I said, we have a whole range of partnership action areas around those 10 priorities, and I think the indicators and discussion of indicators is really helps to know sort of where you're trying to head and get some agreement on that as well, and also to inform the sort of partners that we need to work with. And I think there's some really good work being done around that as well. Informing integrated planning, and that's been talked about a lot today. But I think that working together, it really and indicators are a point into that system. They're not the starting point, but they're part of that process and part of the discussion. Research gaps, so actually finding out where we don't have good evidence and advocating for those. A couple of examples I can immediately think of is issues such as packaged liquor outlet density. You know, I know it's amongst many issues, but it's one that's wherein, you know, we've had a number of discussions in our local government about, you know, how we can start looking at building the evidence, getting some indicators around it. As well, because it's certainly an issue for our municipality, and our planning area is trying to push back on some of the development of packaged liquor in our municipality, particularly in some of our more vulnerable communities. So we need indicators and we need data to start working in a more integrated way across some of these issues of alcohol harm. And food security is another example. So hopefully defining indicators and monitoring over the time will strengthen the links between evidence, policy and practice, and ultimately improve our effectiveness to achieve health and wellbeing outcomes. And just finally, I just want to say that really the process of negotiating the ownership of an indicator framework across council and with partners has been time consuming. I think with the previous plan I thought, wow, you know, a couple of years time we're just, you know, everyone's going to go indicators, and we just, you know, it didn't quite happen like that. But we've had some really steady movement. We've had a development of a number of new policy areas in council during that time. We've had a development of a sustainability plan, which now has indicators that are aligned with the indicators used in the health plan in our sustainable environment area. So we're getting this sort of line up, and I think that's really fantastic. But I think it's going to take this next cycle of planning, this next cycle of the health plan, should I say, to take an extra step, and I think I feel quite positive about that. And local government is setting the direction and will play a key role in working toward catchment planning, I believe, for health and wellbeing over future years. And we really need to, in local government, I think, or certainly in our local government, understand the value and relevance of indicators and select indicators that align with policy and action in our organisation. So I think over time we'll become more sophisticated with using it, and as we adopt best practice public health planning, indicators are progressively becoming part of the language of local government. I've certainly seen that over recent time, and we're starting to put more of an emphasis on, as I said, effectiveness, not just performance. And that's a sort of a cultural change in our local government. We've now got an effectiveness review going on, and we're able to link in that and say, well, this effectiveness is about public health outcomes as well. So there's some really good things that are sort of happening. So I think this is starting of a change, and really the development of usable, reliable data sets that reflect the key social determinants indicators of concern for local government are continue to be essential and need to be built on for local government to take the lead in this sort of work in our municipality. Okay, that's all I've got to say. Thank you.